Okay, so we will get started. So welcome to our Learning About Memory Loss webinar. My name is Jessica. I'm a public education coordinator with the Alzheimer's Society Southwest Partners. I will be the MC and moderator for today's webinar. Susan Oster, another educator with the Society, will provide technical support today. At the Alzheimer's Society, our role is not only to provide programs and services for people who are going through the journey of dementia, but also provide dementia education and to advocate for those who are living with cognitive disabilities. I would like to begin by acknowledging the Indigenous peoples of the lands that we are on today. While we are meeting on a virtual platform, I would like to acknowledge that the counties of Elgin, Middlesex, and Oxford lie on lands that have been inhabited by Indigenous peoples from the beginnings. As settlers, we thank all the generations of people who for thousands of years have taken care of this land. Long before today, there have been Indigenous peoples who have been the stewards of this place. In particular, we acknowledge the traditional territory of the Anishinaabe, the Haudenosaunee, the Attawandaron, Wendat, and Ojibwe Chippewa peoples. This territory is covered by the Upper Canada Treaties. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions of the Métis, Inuit, and other Indigenous peoples have made both in shaping and strengthening our communities, in particular, our province, and as a country as a whole. Before we start, I just wanted to go over a couple of housekeeping pieces related to the webinar experience. So please note that all of your cameras are turned off, and so are your microphones. This webinar will be recorded, and the recording will be available following the webinar. At the end of the presentation, we will have 10 to 15 minutes for a moderated question and answer session. We will do our best to address as many questions as we can. So during the presentation, if you think of a question for myself, then please type that into the Q&A box located at the bottom of the screen. If you would like to submit a question anonymously, please click the Send Anonymously box before clicking the Send button. Should you have any technical concerns, please type in the chat box and Susan will be happy to help you. You may need to move your cursor around to see the Zoom controls and icons. You can submit your technical concerns in the chat box, and they will only be seen by myself or Susan. Lastly, we have also enabled the upvote feature in Zoom, which allows people to see all questions being asked and to move the most popular questions to the top of the list. If you see a similar question posted by someone else, you can simply upvote the question by clicking the thumbs up icon underneath the question as seen in this picture. Once the icon is clicked, the question will move up in the list. And since everybody's situation is unique, the information being provided in this presentation is for educational purposes only. Should you have specific questions about your situation, please contact your support worker. So with that, we're going to begin our webinar, and I'm going to highlight the outline for today's presentation. So we're going to learn about statistics. We're going to learn about the spectrum of memory loss, beginning with age-associated to mild cognitive impairment, followed by dementia, how we remember, changes in memory, risk factors, causes of memory loss, treatment and support, and lastly, programs and services. So our first stat is apparent in Ontario. So currently, in 2023 in Ontario, we have an average of around 68,000 new cases of dementia. In about 7 years from now, we will see 85,000 new cases of dementia. Looking at a national perspective, there's 600,000 cases in Canada, and in 2050, we're going to see 1.7 million cases in Canada. Looking at a worldwide perspective, we know that dementia is one of the major causes of disability and dependency among older people worldwide. So here we have 47 million people currently living with dementia worldwide. And in about 7 years from now, there's going to be 75 million people who are going to be living with dementia worldwide. So what do we know about dementia? We know that dementia is an umbrella term that describes a wide range of symptoms that are caused by disorders affecting the brain. So for a true form of dementia, it will be progressive in nature, which means the amount of damage will increase over time. It will be degenerative in nature as well, so the neurons will break down. And because of this, it will impact your day-to-day functioning. And at present time, it's irreversible. So the damage that has been done cannot be repaired. And at the present time, there is no cure. So what does dementia look like? So here are some signs and symptoms, and we refer to these as the 10 warning signs. So it includes memory loss that affects day-to-day abilities. So a person with dementia may forget things more often or may have difficulty recalling information that they have been recently learning. So for example, if you know you have an appointment coming up, or if you know you're supposed to have dinner at 6 o'clock, or if you're supposed to have a card game with friends at 2 o'clock. So some of those start to become difficult to remember. Number 2 is difficulty performing familiar tasks. So a person living with dementia may have trouble completing tasks that have been familiar to them their whole lives. So this could be things such as preparing a meal or playing a game. Number 3 is problems with language. So a person living with dementia may forget words, or they may substitute words such as what they are saying is difficult to understand. Number 4 is disorientation in time and place. So people living with dementia can become lost on their own street, or they may not know how they got there or how to get home. Number 5 is impaired judgment. So a person living with dementia may experience changes in judgment or decision-making, such as not recognizing a medical problem that needs attention or wearing heavy clothes on a hot day. And then number 6 is problems with abstract thinking. So someone living with dementia may have significant difficulties with balancing a checkbook because of the loss of numbers is being associated with dementia. Misplacing things. So for someone living with dementia, they may misplace things in uncommon places. So for example, we can see this woman is putting a dress in the freezer. Another common example would be putting your keys in the sugar bowl. Changes in mood and behavior. So someone living with dementia can show varied emotions or mood swings. So from being very calm to tears, or to being very angry for no apparent reason. Changes in personality. So a person living with dementia may become confused, suspicious, or withdrawn. And these changes may also include a lack of interest or fearfulness. And lastly, number 10 is loss of initiative. So someone living with dementia may become passive, disinterested, and require cues or prompting to be involved. So there are some common forms of dementia that fit under that umbrella, and Alzheimer's disease is the most common form. So the damage from Alzheimer's disease will start where we make those memories, which is why short-term memory loss is an early symptom. And then it slowly progresses to other regions of the brain. Some other common forms of dementia include vascular dementia. So vascular dementia is caused by skills that are caused by conditions that are blocked or reduced blood flow to various brain regions. And so essentially the brain is deprived from oxygen and cannot carry out day-to-day functioning. So this can be followed by a major stroke or a series of several mini strokes. Lewy body dementia is caused by abnormal deposits, so Lewy bodies that form in the brain, and these form in brain nerve cells. So an Lewy body shares many similarities to Parkinson's disease. And lastly, frontal temporal. So frontal temporal is a rare form of dementia. It is encompassed again by an umbrella term, and a couple of variations include the frontal aspects. So problems with language loss occur, disorientation, behavior, personality changes, and difficulty producing or comprehending language. So each person living with dementia has a different journey with dementia, and dependent on where that damage is in the brain is how someone will be characterized and how they will express their form of dementia. So we have several lobes in our brain, and this just shows a visualization of them. And while the brain lobes work simultaneously, they work well as a unit and they work well together. So when one of the brain regions is damaged, this has an effect on other brain regions. So looking at the differences now between normal aging and Alzheimer's disease. So with normal aging, someone could make a bad decision once in a while. With Alzheimer's disease, because of that frontal lobe damage and that impulse control, they may make poor judgments and decisions a lot of the time. With normal aging, missing a monthly payment, and because of that loss of abstract thinking, with Alzheimer's disease, we may see problems of taking care of the monthly bills. With normal aging, we may see forgetting which day it is and remembering it later. With Alzheimer's disease, because of that disorientation to time and place, we may see them losing track of the date or time of the year. Normal aging would be sometimes forgetting which word to use. And again, because of that aphasia or loss of language, folks living with Alzheimer's disease may have trouble having a conversation. Normal aging would be losing things from time to time. And with Alzheimer's disease, misplacing things often and being unable to find them. Now I want to show you a video, and this is a common question. So I have trouble remembering things. Does this mean I have dementia? Well, listen and see.
I have trouble remembering things. Does this mean I'm getting dementia? As you grow older, it's easy to jump to conclusions about your memory, especially after you've lost your house keys again, or drawn a blank when faced with someone you know you've met before. These small lapses of memory and attention can feel like the end of the world. But it's important to remember, your brain is a very complex organ. Forgetting the odd word or name doesn't mean you're getting dementia. And yet, these lapses of memory could mean something. Because many different things can affect your memory. Over-the-counter or prescription medications, excessive use of alcohol, or an underlying medical condition that you might not even be aware of. Even psychological causes can affect memory. because when you feel depressed or experience ongoing stress, your brain releases a hormone called cortisol into your bloodstream. High levels of this cortisol can impair the cells in your hippocampus, a part of the brain vital for making memories. This can make it more difficult for you to create new memories or retrieve old ones. So, you may well have a memory problem, but it doesn't necessarily mean that you have dementia. You need to be aware of your brain health, and most importantly, see your family doctor about your memory concerns. Because a doctor can help identify any underlying conditions that could be affecting your memory, or help you to manage stress or anxiety in a healthy way, if that's the issue, or change or stop medications that may be causing your memory problems. And remember, some causes of dementia are treatable, even reversible, which is added incentive for you to book an appointment with your doctor for a memory check. And a little comfort, your doctor might not bring the bad news you've been dreading.
So as mentioned, it's normal to have some memory loss as we age. And also there are reversible types of dementia, which we'll talk more about shortly. But diagnosing reversible types of dementia is one of the reasons why it's so important to see a medical professional about your memory concerns. And if it's reversible, of course, we want to reverse it. So let's dive into age-associated memory loss. So almost 40% of people over the age of 65 experience some form of memory loss. So this type of memory loss doesn't affect day-to-day life. So that's a key feature there. When there is no underlying medical condition causing the memory loss, it's known as age-associated memory impairment, which is considered a normal part of the aging process. So more on age-associated memory loss, we can see that declines are very subtle. Normal aging affects areas of the brain, including slowness in thinking, sustaining attention, multitasking, holding information, and word finding. And again, a key feature, it does not impact day-to-day functioning. So now we're going to look at mild cognitive impairment. So we learned about dementia. And dementia has a very large impact on your memory. We just learned about normal aging or age-associated memory loss, and that has very small effects on memory. When we look at mild cognitive impairment, it's in its name. The nature of the cognitive decline may be mild or very subtle. So understanding mild cognitive impairment, we see that problems in certain areas of thinking which involve memory. So for example, someone may have difficulty remembering someone's name, or difficulty speaking, or just finding that right word. And again, it's subtle changes in thinking. So these changes are mild by nature, and they do not impact your ability to manage day-to-day responsibilities. So similar to age-associated MCI, again, doesn't have that impact on the day-to-day abilities. And we even see some may improve back to normal aging. So just some statistics surrounding mild cognitive impairment. We see that 5% of Canadian seniors over the age of 65 have mild cognitive impairment. 2 to 3% without mild cognitive impairment over the age of 65 have a chance of developing dementia within the course of the year. And on the flip side of things, people who have mild cognitive impairment, about 85 to 90% of those over the age of 65 will likely not develop dementia within the course of the year. And how do you know if it's age-associated memory loss, mild cognitive impairment, or dementia. This chart really helps to allude to that. And so with age-associated memory loss, we know that the cognitive decline is not greater than expected age. And we know that it doesn't impact day-to-day functioning. So independence is not being reduced. With MCI, we see that, yes, the cognitive decline is greater than the expected age, but with MCI, the functional decline is not happening. So the individuals still have that independence. But with dementia, we see both. So we see a cognitive decline that's greater than the expected age, and we also see a functional decline indicated by reduced independence. So this is just about how we remember. So there is a 3-step process for how we remember, which involves encoding information. So getting information in, storing that information, so maintaining that information, and lastly, retrieval. So getting that information out. So let's look at how we can encode information. So encoding, there's really 3 features here that our bodies use to encode, or our brains use to encode. So encoding requires paying attention and linking it to existing knowledge to make that information more meaningful to you and easier to remember. So something that is visually encoded is represented by a picture. So it's all the things we see in our environment. Acoustic coding is represented by sound. So everything we hear in our environment. And lastly, semantic encoding is represented by a meaning. So here there's a picture of an apple, and you can associate the apple with it's edible. It's a fruit. It has a stem, it has seeds, it grows from a tree. It's red, it's round, it's sweet. So those are all the semantic information pieces. So there are 3 ways we encode information, and when we encode and when that process happens, we can store that information. So with storage, there's also 3 main storage areas. So first is our sensory memory. So this is brief periods of time lasting only an instant. So this is the impressions of all of our sensory inputs we experience on a day-to-day basis. So whether that be those sights, the sounds, the smells, touch, or taste, that's our sensory memory. Our short-term memory is also very, has a smaller capacity of holding that brief information for a period of time. And it's readily available, and relies mostly on that acoustic code for storing. Whereas long-term memory, with rehearsal and with proper encoding, these thoughts that were in our short term will be transferred into our long term. And we can make these memories more conscious and bring them to our conscious awareness. And thus, it encodes to the long-term memory storage. Lastly, retrieval. So retrieval involves getting information out, and this is our ability to access and retrieve information from our memory, and we can use this to answer questions, perform tasks, make decisions, and interact with others. And 2 main methods here is recognition and recall. So recall is retrieving a previously used information, whereas recognition is identifying information that was previously used. So some examples of changes in our memory we're going to look at past events, so information that occurred recently within the past few hours or a few days. So that would be if you drove somewhere today, do you remember where you parked? What did you have for lunch yesterday? What's the name of the street that runs in front of your building? Or what's the name of your new dentist? Then there's future memory. So we call that prospective memory. So that could be from taking vitamins or medication, so remembering to do that. Or if you have to remember to stop on your way home at the post office, or if you have any upcoming appointments in the future, or any upcoming events such as birthdays. So these features, so there's non-modifiable risk factors that can contribute to some memory loss or lead to the development of dementia. So with non-modifiable risk factors, we know age is the #1 risk factor. So dementia is not a normal part of aging, but the older you become, the more increased your risk will be. So for example, 1 in 20 Canadians over the age of 65 has Alzheimer's disease. And after the age of 65, the risk of developing Alzheimer's disease doubles approximately every 5 years. So with 1 in 4 Canadians over 85 having Alzheimer's disease. Dementia can also affect people under the age of 65. So some people in their 40s or their 50s develop dementia, and this is known as young onset dementia. Next, we look at genetics. So the role of genes is not really fully understood yet. There's a lot of research that goes into this, but what we do know is scientists have found over 20 genes that may increase your risk of developing Alzheimer's disease. So if a person has any of these faulty genes, they will most certainly develop familial Alzheimer's disease before the age of 65. So we do know that familial Alzheimer's disease is rare, and it accounts to 7% of all forms of familial Alzheimer's. And then sex. So the difference between women and men. So we know that women are at a higher risk of developing Alzheimer's disease as opposed to men. Well, again, this is an area that is still being researched. We know some contributing factors allude to that women, on average, tend to live longer than men. There may be some changes in estrogen levels over time, and the presence of frailty and other health conditions, which tend to be higher in women. I'm not going to get too in-depth in these because we do have a Heads Up for Healthier Brains webinar. August 16th is that date. So my colleague will be going over these in more detail of how we can control some risk factors that lead to the development of dementia. So we can see a lot of these things, again, have to do with our vascular health. So we know what's good for the heart is good for the brain. So what causes memory loss? So here are a couple, as the video referred to, treatable causes of memory loss. And we saw that in the video, depression, anxiety, and stress was one of those causes. So when we experience those mood conditions, we have in our brains cortisol, which is released, and that can further slow down the brain, causing concentration problems. We see medication side effects here. So that could be the side effects from medications, or if medications are interacting with one another, how will that have an impact on your brain? And we see vision and hearing here. So we saw that for encoding, it really involves seeing and hearing. So both acoustic and visual encoding. So with those impacts to our vision and hearing, if we're not wearing hearing aids or glasses to aid those, then we have troubles encoding and storing that information. Nutritional deficiencies. So if you lack nutrition, then your brain essentially is lacking function. So we need proper fuel to fuel our bodies. And when we do that, it can also fuel our brains and set them up for success. Infections, so things such as a urinary tract infection can play a role in memory loss. Metabolic disorders, so things such as an underactive thyroid or diabetes can play a role. Sleep disorders such as sleep apnea, so not getting enough sleep, essentially our brains will be slowed down the next day, so making sure you get that quality of sleep. Delirium, minor head trauma, so just again, my colleague will focus on all of these in our next coming webinar and how we can, create that environment that will keep our brains safe and supported. Alcoholism is another treatable cause of memory loss. B12 deficiency and social isolation. So what can you do to support your memory loss? And again, in Heads Up for Healthier Brains, my colleague will focus on these more in depth, but we can challenge our thinking, we can engage in new information, and our brain is like a muscle, so we have to support that. And when we do new activities, our brain is stimulated in different ways. Staying socially active, so just, if we were in person, that would be great, and it would be supportive of your social stimulation. But if I don't get a chance to talk to you, if you have a chance, maybe go outside today and say hello to somebody. Adopting healthy behaviors. So again, what's good for the heart is good for the brain. Avoiding head injury, being active each day, maintaining hearing and vision, getting a good night's sleep, treating emotional disorders, limiting alcohol intake, finding purpose, protecting your heart, and managing overall health. Some other tips for memory loss would be creating a daily routine, using to-do lists. So throughout the day, a bunch of ideas start to be collected in our brains. So the to-do lists are great because you can make room for new information and have that down as a visual to see. And other memory tools such as calendars and notes. So writing all of those future dates for the prospective memory in a calendar can be really beneficial. Putting frequently used items in the same place. Staying involved in activities that stimulate the body and the mind, and volunteering. So volunteering really allows you to have that use it or lose it philosophy, and is a great way to give back to your society as well. So treating mild cognitive impairment. For mild cognitive impairment, there have been behavioral interventions and also controlling vascular risk factors. So some of the risk factors I've already listed, but controlling healthy diet, physical activity, cognitive activity, socialization, and treating high blood pressure, preventing stroke, and learning the ropes for memory loss. So this is a course that was developed by Baycrest, and it's been running since 2003. It takes a holistic approach, so really focuses on all those domains of wellness, and is a course to help support those who are experiencing mild cognitive impairment, and teaches education, why it may be happening and how to support that memory loss. And that is a 6-week course to look both at the physical and mental health by providing knowledge and resources. And lastly, there is no medication for mild cognitive impairment except medications that control vascular risk factor. And with medication, we always want to be talking with our doctor about that as well. So treating dementia includes also pharmaceutical approaches. So folks who are living with dementia, they have a lower level of acetylcholine, and acetylcholine is really imperative for learning and for memory. So with the medication, it increases the acetylcholine, and also on the another chemical in the brain that medication plays a role with is glutamate. So folks who are living with dementia have excessive amounts of glutamate blocking neurotransmitters. So with medication, it reduces the glutamate, and it helps to support different memory functions. So again, always talk to your doctor about the pharmaceuticals. On the other side of things, the non-pharmaceutical approaches include alternative therapies. So whether that be music therapy, music is really beneficial for the brain. Aromatherapy, so we want to engage a lot of different senses. So aromatherapy, you can engage those smelling senses and using your olfactory region there. Pet therapy, who doesn't love dogs or cats? And massage therapy as well. So just releasing those stressful cortisol in your body. Deep breathing, I would add as well. Okay, so getting a diagnosis. There's no single test to diagnose. So the physician or the medical professional can rule out some criteria based on a number of processes here. So they'll look through your medical history. There may be a physical exam. They maybe conduct laboratory tests, cognitive tests. So things such as the Montreal Cognitive Assessment, CT, MRI, PET scans are completed, and neurological testing. So there's various ways that healthcare professionals can diagnose for dementia. Okay. So if you are concerned about your memory or someone else's, there's a couple of things we can do here. So talking to your family is a great idea. Talking with your doctor and asking for a memory screen, or calling the Alzheimer's Society in your area. So now I'm going to just explain some programs and services at the Alzheimer's Society. So how can we help you? The Alzheimer's Society Southwest Partners, also known as ALSWAP, offers a wide range of programs and services designed for individuals with dementia and or memory concerns, their family, caregivers, and health professionals, as well as the general public. And for those of you who are unaware, as of July 1st, 2021, the Alzheimer's Societies of London and Middlesex and Elgin and Oxford have unified to create one society. So this is how our overview of programs and services work. So first of all, for referral, you do not need to have a doctor for referral. You can make a self-referral. So in the middle is the person living with dementia and their care partner, and they're supported by all of these various programs and services. So with our first link, care navigation, basically what happens is the first link navigators will look at community resources and make referrals or look at different organizations, and also making internal referrals. Our clinical services, so we have social support work and also support groups. Our education services, so what we're doing right now, but there's also First Link Learning Series and Care Partner Education and various public education services as well. therapeutic recreation services. So there's in-home recreation, virtual recreation, and the social, which is a day program setting. So dementia-friendly communities. A dementia-friendly community is a place where people living with dementia and their care partners are welcomed, included, and supported. It's a community that pays attention to the social and physical needs of the person living with dementia. And a dementia-friendly community is dementia-friendly informed kindness. So this is for everybody. So local governments, the professional sector, community groups, and the general public, we can all work towards becoming more dementia-friendly. And finding your way. So 60% of people with dementia become lost at some point. And finding your way is a resource to help people living with dementia and their families, and to support communities as well, to recognize the risk of going missing, to be prepared for incidences of going missing, and to ensure that people with dementia can live safely within the community. Okay. Thank you again so much for joining us today. For those of you who have signed up, I will message you back with a recording of our webinar and also a couple of housekeeping items. But for this, you can scan this lovely barcode and you can fill in the feedback survey of how you receive the presentation. So, and be sure to hit leave on your screen too to receive that code as well. So thank you, everybody. Hope you have a great rest of your day, and I give you 11 minutes back of your time. So hope to see you guys again soon, and thanks again for tuning in.